The healthcare system is broken, but it doesn't have to be. This is Revenue Cycle Optimized by Infinix Healthcare. We discuss the latest challenges in the revenue cycle space and provide actionable tips on how to overcome them at your organization.
Good afternoon, everyone, and welcome. I'm Stuart Newsom, and today's session is titled A HFMA Buyer's Guide, How to Separate Revenue Cycle Strategy from Noise. So this is a little different title than what we've usually done in the past. Today, we're really going to be looking at ahead, so to speak, to HFMA annual conference. It's going to be next week. I believe it's going to be June 7th through the 10th or 11th. Sometimes I'm not good with dates. And so while we're there, we're going to be talking about how healthcare finance and revenue cycle leaders can prepare for the conversations that'll be had there and likely to have before they ever step onto the conference floor. So we're going to cover a lot of that here today during this session. As many of you who have been to HFMA, if you ever have, or any conference for that matter, you know it's full of vendors and platforms and consultants, AI tools, and more AI tools, and more AI tools. And then there's automation promises and revenue cycle solutions. So the challenge is not so much finding options, because there's plenty of those. The challenge is knowing which options are going to be strategic for you, which ones are proven and trusted, and which partners can actually help organizations execute on that. So I'm joined today by two members of the Infinix business development team who spend a lot of time talking directly with healthcare leaders about the pressures that they're facing across the revenue cycle. So we have Taylor Searfoss as well as Sean Dennehy. Now, both of these are vice presidents of business development here at Infinix Healthcare. They mainly handle the acute care side, but they can also answer any questions regarding ambulatory as well. So, hey, fellas, how are y'all doing?
Doing good.
Hey, Stuart.
All right, guys, y'all ready to go?
Sure.
Let's do it.
All right. So first question, I'm going to direct this to you, Taylor. Certainly, Sean, you can chime in as well. But why does HFMA matter right now?
Let's say if we're looking at now specifically, and this is just, of course, my opinion, I'd say, it probably matters more now than it has in a really long time. Health organizations are navigating just financial and operational pressures across the board. Margins are thin, labor costs elevated, payer complexities, it continues to increase. Nothing's getting easier in that realm. So they're being asked to do more with fewer resources. I'd say at the same time, we're seeing a lot of rapid changes in technology. AI, it's everywhere. It's a huge buzzword right now. Things are becoming more automated. Data analytics, we're being able to see things that we just haven't before because there's new insights. So that creates both opportunity and, let's say, uncertainty, especially in the AI space, as that's really the leading conversation right now. Where is that going? And that's not just in the healthcare industry, that's across the board. So I'd say leaders are looking for ways to improve their financial performance without really compromising that patient care. So to summarize that, I'd say why HFMA is so valuable right now is that it brings together the financial leaders, the operational leaders, technology innovators, industry experts, all in one place. It brings everybody in the room having a dialogue conversation together and not just discussing challenges. It's about really showing proven strategies, because there's some people that have implemented things successfully, some that haven't, and you can learn valuable insights equally from both. It also provides a forum where organizations can learn from another, benchmark against peers, gain insight into what's actually working across the industry. So for many of the leaders that attend HFMA, I'd say it serves as a compass during a period when the industry is really being asked to transform at kind of an unrealistic pace with AI and everything else going on right now.
Yep, exactly. So, and you kind of alluded to this a little bit in that answer, but what problems, particularly business problems, are leaders bringing to HFMA?
Yeah, I'd say if I could think of a couple, first, I'd say financial performance. It's a big one. Organizations are struggling to keep doors open. They're looking for new ways to increase margin. So really that improving margin, reducing the revenue leakage, strengthening cash flow in already challenging environment. Another one, I'd say workforce efficiency. So this is where that AI, the automation comes into play. Continue to face the staffing shortages right now. The organizations are continuing to face that across the board. So looking for ways to automate a manual process, as well as help the teams work more effectively with what they already have to optimize their performance and their time. As situations and just the workflow of things becomes more difficult, more complex, how can we take that out of the human touch points and make it as easy and as efficient as possible for them? And then I'd say another one is really the payer complexity realm that I mentioned earlier. Denials aren't decreasing. So rising denials, prior auths are always going to be an issue. Reimbursement pressures. It's driving interest in solutions that can help organizations prevent that revenue loss before it happens. So I'd say across all those areas, there's a significant interest in AI and automation. I mean, we hear it everywhere. So leaders are focused on really the practical applications that deliver the measurable results, and not just technology for technology's sake, but what's actually working. If I do this, what do I get out of it?
Exactly. It's more from an impact perspective, because to your point, when I'm listening to prospects and even clients and people having conversations, there's still this perception that AI and automation is going to solve it all, right? And so it's certainly a huge piece of it, but either you remind them and there's a strategy where it's more or less AI and automation plus obviously some manual human in the loop, human specialists also involved, processes. It's really more about process, but I think you nailed it on the head when it's really more from an impact. What impact is this going to have on the revenue, on efficiency, timing, on burden, staff, all that kind of lines up with that. So, Sean, to follow up with that, it's kind of a related question here, but where is the market noise the loudest?
Yeah, so I would break that question up in a few different ways. Stuart, I think your office hours you did last week with Taylor and I's counterpart, Scott, where you talked about, kind of the rural aspect, critical access, and that rural transformation fund. That office hour was really timely for what I was hearing a lot at a lot of the HFMA spring conferences and my conversations in kind of the Mountain West and West Coast with some of the revenue cycle directors, CFOs, and other thought leaders on the provider side of the house. But just getting into, regardless of geography and regardless of whether it's critical access all the way up to a large IDN and everything in between, you're hearing a lot of the same topics. You're hearing, some of the challenges with prior auth. I think you're hearing all things like AR denial. Stuart, you did a previous office hours on down coding. That's a topic we're hearing. And then a topic I'm hearing that I really want to draw attention to is, think about what can your EHR do and maybe where is it limited? And I'm hearing a lot of some challenges and frustrations with respect to charge capture of where are things like Epic's Rev Guardian and things of that nature, where we're still, we've implemented a lot, and where are we still feel like we're missing things in certain aspects. And so I think that's something that I'm really passionate about, especially on the more outpatient side of the house, on the hospital, on the acute side, is some of those challenges around Rev Guardian and our different things related to our EHR we still feel like there's room to be desired. There's more to be desired when it comes to charge capture. And so that's just another challenge that I'm hearing that I kind of want to draw attention to.
Yeah, absolutely. And I think, a very good point. Charge capture is one of those elements that people take for granted. Missing charges, I would like to probably call it charges. You're not charging for things you actually did. So there's all types of opportunities just at that level alone because revenue cycle is so complex. And to Taylor's point earlier, it's all about prevention, denial prevention. That's the best mitigation for denials is to prevent them in the first place. So it's looking at those signals that you see in those dashboards. And it's that death by dashboards, you will. You can have a pretty dashboard, but what impact is that dashboard having? And you can use dashboards certainly for those signals to help look back at the process, go further upstream. And charge capture is definitely one of those areas that you can capitalize on that for sure.
Definitely.
Feeding off, Sean's answer, Taylor, what separates a true partner from another vendor? He made some good points about what's loudest in the market, and you made some good points as well in your answers earlier. But just kind of want to look at, I'm going on the floor, I'm at HFMA, there's so many vendors, everyone's kind of saying the same thing. What's the difference maker for trusting a partner from another vendor?
Yeah, I mean, I think a partner, no matter what industry you're in, being a true partner focuses on outcomes, not just a product set or a solution there, but what is it actually meant to do? What is the purpose that that product is there for? focusing on the outcomes, not the technology, all that. What is the technology trying to solve for? What is it trying to do and accomplish? Making sure you're focusing on that piece. A vendor, we use these terms all the time, and I hear, hear things in the marketplace, but vendors sell solutions, where a partner, like I mentioned, will take the time to understand an organization's goals, their challenges, financial objectives, and then work alongside them to really achieve those results. So in revenue cycle, I'd say that means helping improve reimbursement, revenue leakage, increase efficiency, and adapt to an ever-changing healthcare environment. So the best partners really don't disappear after implementation. That's when I'd say they should become more active and more visible, because they're staying engaged, they're bringing industry expertise, and are invested in their clients' long-term success and those outcomes that I mentioned a minute ago.
Awesome. Yeah. And those are, you got to have proven record, obviously, and have solutions that are going to be meaningful. And you also earn that trust as the journey goes along, and it's not like, trust this partner. Certainly you take that first step. It has to be that proof of concept and some credentialing, so to speak, and from a partner perspective. But it's also, that trust is earned. And I think we here at Infinix really look at earning that trust and look forward to earning that trust. So with that in mind, Sean, just kind of following up on that, what should leaders understand about Infinix?
Yeah, and I think that question and my answer would definitely piggyback a lot of what Taylor just said, but I'm really passionate about Infinix. We're not just a seller or a vendor. We really are truly a business partner. And so if, myself, Taylor, and Scott, if we connect with you at Western Region Symposium, at HFMA National next week, smaller state conference, however we connect with you, we're going to be in, let's say you engage with us for, like we're talking about charge capture. Myself, Taylor, and Scott, we're going to be with you that entire step of the way. There will be no disappearing, no ghosting. So if you engage with us, HFMA is near and dear to all of our hearts. You're going to continue to see us at these events. You'll be able to get a hold of us at any time. So we really are going to be with you every step of the way. So say we meet you at HFMA, National this week, myself, Taylor, and Scott, we're not going anywhere. We're going to keep getting in the car and getting on planes, and we'll be with you at all these conferences, and we'll be with you every step of the way throughout any engagement or partnership, however we can help.
Certainly, yeah, it's that personal approach, and we value relationships, building that relationships. Because if you're going to, the intent is to work with someone for a fairly long time, because RCM is very complex. There's a lot of nuances, particularly just take charge capture, for instance. That could take a good while to implement. And you want to be with someone who's going to be with you along the way. Not necessarily take a long while to implement, but just it's a process that requires a great relationship. And when I think about that, when I think about going back to the question of, what separates a true partner from another vendor, kind of a follow up on that, for you, Sean, would be, what mistakes should leaders avoid? And just covering everything. I mean, again, I'm walking on the HFMA floor. What should I avoid? A mistake that I may make with any particular vendor.
Yeah, I think, where I would kind of give up a polite challenge to our friends in the provider community is just try to get away from certain assumptions and mindsets and just be as open-minded as possible. Try to get away from a certain attitude of, if I do partner with a vendor, another business partner, it's going to be dollars. It's going to be, we already have enough going on. It's going to be another thing on my plate. We already have other initiatives. I would just challenge, stay open-minded. Don't develop a mindset of, we can't afford to do this right now, whether it's financial, IT, bandwidth, whatever. And try to get more in the mindset of, we can't not afford to solve some of our challenges that we have right now. So just try to put aside all assumptions, being open-minded as possible. Talk to your vendors, business partners at these events, and just see where they can help assist with, a quick engagement. Maybe there is something different there is a lift financially, there is a lift on FTEs and bandwidth, and just see where can we assist. And maybe we can work together to get a problem solved immediately. And you're going to say, I'm really glad I didn't kick the can down the road or kind of put this off. And this did complement some of our other initiatives and items we had on our fiscal year and calendar year agenda very nicely. And we did improve some KPIs. We did get some revenue leakage fixed. Yeah, there's a vendor out there and a business partner for you who can help you fix something pretty quickly.
Awesome. Exactly. I mean, it's really, it is a process, and there's a lot to consume. And it's kind of, the advice that you've given is, yeah, having that open mind is crucial, and also listening, but also you want to be sure they're listening to you. I've often said that the art of listening is a lost art. It's just understanding, slowing down, what is the customer's burdens. Don't make any assumptions. And if they're making an assumption about you, don't make the mistake of, you just need to make sure that they're listening to you as well. So I'm going to throw that in there. And on that note, I am going to kind of throw in a bonus question because, we walk in, and I've just noticed this the last several years, everybody has AI and automation plastered all over their marketing, all over their booths. It seems to be like, I remember back when you had to have .com on all your marketing, or it's always these trends, and now it's AI's turn, and AI is the
Careful.
trend.
You age
And
yourself there.
yeah, I know I did, didn't I? But AI is definitely the trend, and there's always what we've discussed is kind of some issues on how to pick a true partner. That kind of certainly goes into that, but ask for to back that up. So kind of have this question for both of you, if you want to chime in. So, how should leaders evaluate those claims about AI and automation that they have in all their marketing material?
I think it ultimately goes to some of the key themes we've been hitting on is, develop that relationship, meet with that business partner, see is this someone I can trust? And then to Taylor's point, making sure they're meeting you where you're at. You're a director of rev integrity, you're a director of revenue cycle, you're a CFO, making sure the business partner is listening to you. What are your unique challenges? We talked earlier about how there's some, industry-wide things we've been seeing. The question was about the loud market noise, I believe. So, but at the end of the day, while there are common themes, there's also really unique themes within each of these hospitals and health systems as you meet with them. So making sure you've got a business partner vendor that's going to listen to you, meet you where you're at, and then can kind of tailor, where does AI automation for us human in the loop, where could that make sense, and ultimately just work to solve a problem instead of just kind of some AI or automation that's just kind of cookie cutter.
Mm-hmm. Mm-hmm. Exactly. And you got to ask questions that we probably can do a whole nother office hours on this one question alone, quite honestly. But I do believe that it's asking them to show, proof of that AI, and be upfront, and dare I say, be honest about what they mean when they say AI. And again, going back to what I originally said in the beginning, there is a perception that AI is going to solve everything. It's just not. RCM is just too complex. There's too many moving parts. There's too many variables, with payers, with plans, with providers, with specialties, with regions and geography. There's just so much going on and regulations, and everybody's got different policies. It's really a unique nuance above and beyond any other industry out there. So AI certainly can solve key things and make things easier, but in a lot of ways, it definitely, knowing that it has its place, you just need to get them to qualify, what they mean. So if they're making claims of AI and automation, and that includes us, as well. When you see us there, be sure that you ask us to qualify when we make those claims as well, because we have a lot of platforms, we have a lot of AI, we have agentic AI on. One key thing is, with machine learning models, is that being developed? What is the platform? What is the structure? These are key questions that you need to ask. Where is it being developed? Where is it housed? Where is it hosted? Things of that nature. So that's really for the questions I have. We're now going to go to the Q&A portion of the question. And I do have one here that seems pretty obvious. We probably should have said this in the beginning, but all right, going to be at HFMA. How do I find you guys?
So Stuart, we will be at booth 636. So definitely swing on by. We'd love to chat with you. And yeah, kind of to that last point, Stuart, you kind of got the wheels turning, but on the, ask your business partner and vendor, and we'd be happy to talk with you at the booth too, but use it as kind of building blocks with AI and automation. So you've got what your EHR can do. The EHRs are getting, they're doing their own thing, getting better on AI automation. And then where can your business partner vendor come in on top of that? And then where can your business partner vendor help, or even AI automation can catch it? Maybe you need human in the loop or kind of more on the service side. So use all of that, view it as building blocks to ultimately get you to better rev integrity.
Right. Exactly. Yep. And so we got the booth number 636, right?
Yes.
Now, and you can't miss us. We'll have a big booth, 10 by 20. It's going to have heal revenue pain. So that's our message. Heal revenue pain. And I want you to notice that of everything on our booth, we don't have AI or automation on our booth graphics at all. So it may be the only vendor in the whole exhibit hall that does not have AI on there. But that doesn't mean we don't use AI. We do. We have plenty of AI throughout our platform, throughout our processes. But our main theme is heal revenue pain. So you can find us there. But before we go, I do also want to do a plug. We are hosting and actually putting on an executive forum. It's going to be in Hyde Park or Chicago, campus of University of Chicago. And it's not going to be your normal conference. It's actually going to be a hands-on, collaborative, interactive session of different sessions, Q&A, things of that nature between CFOs, CEOs, VPs of revenue cycle. So if that interests you, please sign up. We're going to have the head of the medical school is Tom Jakowitz, and we're going to have Dr. Tony Tedeschi, who used to be CEO at Tenet. We're going to have many others, myself included there. Could be those here on the team as well, may be there as well. We're putting that together, so register by June 15th. That's our so-called cutoff point. We'd love to save a spot for you. So please go to Infinx.com to register for that. You can also go to Infinx.com for more articles, case studies, and insights on all things RCM. So John, Taylor, really appreciate you guys being on today.
Absolutely.
Pleasure to be here. Thanks for having us, Stuart.
Right. And we'll see all of you at HFMA next week. And just reach out and contact us for more details about that executive forum.
Thanks for joining us. Subscribe to get notified when our next episode is online. For more information for how we can help you increase reimbursements at your company, check out our website at Infinx.com. That's Infinx.com.